As the evening wore down, my wife and I decided we would take him to the doctor the next day if he weren't feeling better. Bounded by a high density of people on three sides, the Long Island Sound isn't known as the cleanest body of water. My wife and I had both earned doctorates in microbiology and immunology at Duke University, and we reasoned that Grant might have ingested some unwanted organisms, perhaps a common water parasite. My wife had an early morning meeting, and since she had taken off the previous day, I volunteered to take him to the doctor. On Wednesday morning, Grant was still in bed after the rest of us had dressed and eaten breakfast. This was unusual indeed, and we checked in finding him weak with a higher elevated temperature, now reading 101 degrees Fahrenheit. Most troubling were the sunken eyes, which lacked the spark that had always characterized his ever-present bounciness. Likewise, his pasty complexion contrasted with the well-tanned boy of just 2 days before. Rather than wait for the doctor's office to open, my gut instinct was to take him to the local hospital, a satellite of the Yale New Haven Hospital, YNHH system, one town over. Barely able to walk, Grant leaned heavily on me as we approached the automatic double doors to the emergency room. This particular hospital is in a quiet part of a quaint New England coastal town in Connecticut. The receptionist saw us coming and met us at the door with a wheelchair. Grant was wheeled into the emergency room and helped into a gurney. Fortunately for us, it was a slow day in the emergency room, and the young doctor was able to focus on Grant. His pallor was an obvious sign of dehydration, and 2 intravenous lines were masterfully snaked into his small, collapsed veins. Within the next hour, more than 3 liters of fluid were fast dripped into him. Rehydration works wonders. Grant started to look and act a bit more like the boy we had known for the past 12 years, playfully scolding me in front of the doctor for my not believing he was actually sick. While the improved spirits were encouraging, his eyes remained dull. With the intravenous line established, the doctor also began a course of treatment with 2 antibiotics to address potential causes of Grant's fever. One of the antibiotics selected was Flagyl, whose generic name is metronidazole. It is an older drug, first approved in 1963. After a thorough history was obtained and an examination performed, the young doctor recommended that Grant have an ultrasound to assess the integrity of his abdomen. A key question was whether his appendix might be inflamed. The gurney was wheeled into the ultrasound room, and the technician performed a general assessment. Everything seemed in place. Whereas the doctor and technician anticipated an inflamed appendix, this wasn't seen. In fact, the appendix seemed to be hiding. The technician excused himself and returned a minute or 2 later with the head of the imaging unit. Neither was able to find the appendix, which, I learned, was not necessarily unusual, as a non-inflamed appendix can be quite small. He was then wheeled back to his room. Having reviewed the results, the doctor suggested we might want to move Grant to the parent YNHH hospital in New Haven. She had already inquired as to the availability of a bed at the hospital. She informed us that he would be number 812, which meant that there were 811 patients with priority over him. The doctor also recommended one last test, a CAT scan, to peer inside his abdomen. Grant was rolled into the CAT scan room and shimmied onto the cold stage. I left the room while the radiologist did his job, and immediately thereafter, things began to accelerate wildly. What had been anticipated to be a laid-back morning in a doctor's office transformed into an hours-long blur of surgeons and confusion, and a roller coaster of emotions. I walked with the gurney as it was being wheeled back to his room, and the doctor pulled me aside and said that Grant was now number 1 in the queue for YNHH. Moreover, they had already summoned an ambulance, which was now waiting to expedite his transfer. Grant's appendix was not observed in the ultrasound because the organ no longer existed. The inflamed appendix had disgorged its contents, as well as a healthy dose of Grant's internal gut bacteria, which had distributed themselves all throughout his peritoneal cavity. In other words, the beneficial bacteria that lived in his gut and helped him to digest his food were now strewn throughout his